Hi, my name is Rachel Clarkson and I am the DNA dietitian. And in this video, I'm going to be telling you how I actually came to be a personalized nutrition expert. So it all started out where I was basically learning and studying all about the science of how to prevent inflammation through what we call anti-inflammatory drugs. So that was a biomedical science degree. And at that point, I was like, yeah, okay, we do have the treatment to treat inflammation, but actually what I want to do is prevent inflammation. And that's when I decided that I really wanted to study the science of nutrition. So I went down to London and started studying at King's College. And at this point, I was really introduced to the science of nutrition. And that meant all the biochemistry, the molecular biology, all that happens at a micro level in the body. And so it really uncovered all of the science that led to the outcome in the body. So it was really exciting to understand the science behind the nutrition rather than just, thinking about what foods are best. And at this point, I actually did some research into genetics and specifically how nutrition impacts your genetics. This is called epigenetics. It's a very interesting area and amazing in research, although it's not great for testing at the moment as an individual, but we can get to that in another video. So this is when I was really introduced to the power of genetics, and really this sparked my curiosity into how can we actually use this in clinical practice. So I decided that I was going to take my nutrition insights and really develop them further in more of a person-to-person setting. And to do that, I needed to do dietetics. So dietetics is basically what we call the clinical application of nutrition. So in layman's terms, it's about using nutritional interventions to treat and manage medical disease, to support the medical teams in hospitals or in the community, like doctors, for example. So it's a really exciting area. I did that. I studied in some amazing hospitals in London, really training in this area. And then I started out in the NHS, which was a really nice experience in the hospital. And at this point, I was able to use just quite generic nutritional information to be able to support patients. Now, one thing that I found was patients weren't really motivated to actually do the thing they said that they were going to do. And I didn't think much of it then, but looking back, I know it's because it was generic information. It wasn't personalized to them. So really thinking about people weren't that motivated. And then when you were to see them again, they wouldn't have done all of the things that they said that they were going to do because they just didn't have the motivation. I actually attended one of these seminars that we get as dietitians, and there was this amazing speaker called Mariette Abrahams. She's an incredible expert within the area of personalized nutrition and a dietitian herself. So at this incredible conference, she spoke all about personalized nutrition, and a little light bulb went off, and I thought, I have expertise in personalized nutrition because I did my research in genetics. So I went to talk to her after her seminar and I said, listen, I'm really interested in what you do. And she said, well, if you're interested, why don't you come to San Francisco and meet with me and all of the people in the area of personalized nutrition? Because I'm speaking at this event. It's the Personalized Nutrition Summit, an international one. You will meet incredible people. Why don't you come? So I took the leap. I went to San Francisco, and really, it was the most pivotal moment in my career so far, where I was exposed to this incredible industry. I met with founders, CEOs, researchers, but there were no clinicians, there were no nutritionists, there were no dietitians, there were no doctors, there was no one there who actually saw the patient communication, and I thought it was really interesting. So at that point, I had another light bulb moment, and I thought, this is what I need to be doing. There's the science and I have the expertise with nutrition. Why can I not combine the two? So I came away with an idea, and over the next year built out what I was actually going to be supporting patients with. And 7 years on, nearly 8 now actually, we are an incredible team of expert nutritionists and dietitians who use personalized nutrition with incredible personalized insights about how to basically personalize their nutrition and wellness practices in a way that really gets them better results. Now, remember I said that adherence and motivation was really low in the NHS because I was giving generic information. Well, I can safely say that that isn't a problem anymore. I would say that the majority, if not all of our clients who come on board and start eating the DNAWay, they are super motivated and they adhere to all of the advice. Why? Because it's personalized to them. They've got their best body yet. Their digestion is in a better place. They have more energy, more spark, more vitality, better mood. They're having all of the things that they thought that they couldn't get because life just got really busy, and they're getting the results that they genuinely thought weren't achievable. So that is my story of how I got into personalized nutrition. I hope you enjoyed it. If you did enjoy this video and want to gain more insights into personalized nutrition and how you can truly change your body for the better, please click the link below and subscribe. Make sure you like this video. I would love to hear from you in the comments if you have any recommendations for more videos that you would like me to do, that you will find insightful and helpful and actionable.